Another evening at Montgomery Heart Wellness, and I am excited about this talk tonight. We're going to talk about detox diet and heart failure, and I see a number of you are waiting in the chat. If you can hear me, please say yes, give me a thumbs up. If you can't hear me, give me a thumbs down. But I'm excited about this talk because it talks about a condition. As a cardiologist, I see a lot. Heart failure is the most common cause of morbidity to mortality in the United States. It's a problem that people fear. And what I want to do tonight, I have two major goals. One is to give you insight and understanding of what heart failure is. And that's important because if you understand something, it's something that's less intimidating. But two, and more importantly, if you hang out to the end of this show, I'm going to give you insights in terms of simple things you can do to either avoid heart failure or start helping yourself or a loved one if they have congestive heart failure, even before you see your cardiologist or anyone else. And so these are important things, and I want to get right to the topic at hand. So detox diet for heart failure. So why is a cardiologist talking about diet? Someone has heart failure, it seems like that's an emergency issue that needs to be jumped on. You need lots of medication. You might need surgery. You might need transplant. Why are we talking about diet? And is it a waste of time to talk about diet? No, it isn't. And so here's why. Because let's start with the fundamentals of heart failure. First and foremost, what is heart failure? People think that heart failure is something where, oh, my heart is stopping or I'm having a cardiac arrest. No, the phrase heart failure seems more drastic than what the condition is. Heart failure is simply the inability of the heart to circulate blood according to the body's needs. Okay, that can be mild or it can be severe or anywhere in between. But that's all it is. And so heart failure is your heart not living up or delivering circulation to your needs. So let's get into the whys. The underlying problem of any condition, threefold. I like to think of three basic underlying concerns. And those of you who saw my talk on fatty liver, you're familiar with this. I'm not going to spend a lot of time on it. I'll probably do a separate video talking about these three underlying etiologies themselves. Inflammation is one major cause. Inflammation is like a biochemical fire. It underscores virtually every chronic illness we know of. The next one is called oxidative stress. Well, what's oxidative stress? Think of that as a toxic chemical buildup. You have lots of toxic chemicals in your system, maybe based on the foods you eat, maybe based on radiation or other types of things, abnormal sleep. These toxic molecules, we call them free radicals. They lack an electron and they're unstable. And so they bounce around your body, damaging cells, damaging DNA, damaging other tissue, and it causes an aging process to accelerate. So you have an apple that starts off nice and crisp, and you can watch it oxidize on the table. So that's oxidation, that's oxidative stress. And the third major underlying component, again, of chronic illnesses in general, heart failure included, is dysbiosis or dysfunctional microbiome. That's probably the underlying process for all chronic illnesses. It's when your ecosystem, our bodies are an ecosystem. It's made of microbes that live in and around us, bacteria, viruses, and they help us carry out important bodily functions. If that ecosystem is off balance, you may get pathologic bacteria that can cause damage to the intestines, the largest part of our microbiomes in our GI tract. And so you can get leaky gut and all sorts of intestinal problems that has an adverse effect on nutrient absorption. It has an adverse effect on removing and protecting your body from toxins, and it can actually underscore increasing inflammation and increasing oxidative stress. So these are three foundational things that are a problem, not only in congestive heart failure, but in all sorts of chronic illnesses. But let's look at heart failure in particular. What is the biochemistry and physiology? And that seems like some fancy terms. I'm going to get a little bit technical, but I promise you, I'm going to break it down so you can understand it. So you need not to have been a biology major in college or have taken a biology class in high school. But biochemistry is simply the chemistry of the biological system. Mitochondria are little bitty organelles that live inside the cells. Think of the mitochondria as your cell's battery. If the mitochondria is weak, it's like your battery and the cells lack charge. And so a disrupted mitochondria can cause weak heart muscle cells and therefore cause a weak heart muscle. Fibrosis or scarring, it causes stiffening. Anybody that's had a scar, maybe seen someone with a burn scar on the arm, the tissue around the skin where it's scarred is stiffer than the tissue that's not scarred. And then local toxin buildup, that's called oxidation. It causes weakening of the heart muscle, it causes stiffening of the heart, and it causes abnormal heart rhythm. People may have heard of atrial fibrillation or other heart rhythm abnormalities. These things are made worse. So these are some of the fundamental biochemical problems that underscore heart failure. How about the physiology? The physiology is things like blood flow, heart rate, pressure, the hemodynamics of heart failure. The hemodynamics of heart failure is decreased flow of blood forward. So you have decreased forward flow, and that's decreased circulation, decrease of delivering blood to the kidneys, to the intestines, to the arms, to the muscles, to the brain. The other basic hemodynamic problem is increased backflow pressure. That leads to increased backflow congestion. So let's look at a little bit of anatomy of the heart and try to break this down in more detail. So the hemodynamic effects. So let's say you have a heart here, and you have the left ventricle, left atrium, right ventricle, right atrium. The normal circulation of blood to the heart is venous blood coming from the body. That's blood that's coming from the tissues, from the brain, from the arms. From the brain, it comes up here into this right atrium. From the lower body, the abdomen, the legs, it comes up here. It's passed through the liver here. It goes into the right atrium, down to the right ventricle. Then it goes to the lungs on both sides. And when the blood goes to the lungs, it picks up oxygen in the lungs, and it comes back from the lungs to the left side. Notice how it's convenient painted blue here. And when it comes over here, it's red. Red is oxygenated blood. Blue is deoxygenated blood. So when it's working normally, flow goes to the left side, to the left atrium, down to the left ventricle, and out the left ventricle, out to the circulation, back up to the brain, and back down to the lower extremities, delivering oxygen and other nutrients to the body so they can do its work, to the intestines, the muscles, etc. But what happens when you have heart failure? When you have heart failure, first thing you see, the heart muscle is either stiffened or weakened or both, and so you have decreased forward flow circulation. So you have decreased forward flow circulation. That results in decrease in blood going in this direction. When you have decrease in blood going in this direction, you develop what's called a traffic jam. So the blood that's coming from the lungs into the left atrium, it's held up by blood that's not flowing forward. So decreased forward flow results in increased backflow congestion. And what happens is you have increased pressure. So the blood that's trying to move from here to the lungs over starts to back up. It goes backwards. First of all, it goes back here into the lungs. So the lungs get congested, you get short of breath. And same thing here. When it goes back from the lungs, the right heart gets swollen, and the pressure goes down into the lower extremities and the upper extremities. That's why people get swelling in the lower extremities. So this backflow congestion due to the fact that blood is not flowing forward. So the twofold effect is the lack of forward flow and the lack of backward congestion. So what are the effects of these hemodynamic changes? Well, with heart failure, with decreased circulation, first of all, you have decreased flow to the kidneys. So decreased flow to the kidneys, when the kidneys say, I'm seeing less flow, it thinks the body's in shock. So it starts to retain sodium, it starts to retain fluid. And so patients with heart failure tend to swell up. Why? The kidneys think it's in shock, so it starts to hold on to fluid. That fluid gets into third space. You have sodium retention, increased blood pressure. Why does the blood pressure increase? When the kidneys see that they're getting less flow, they secrete a hormone that results in constriction of the blood vessels. And this constriction of the blood vessels increase the blood pressure. So paradoxically, the heart may be weak, but the blood pressure may go up, which could further weakening the heart because the heart's beating against higher pressure when it's already weak. And then you get worsening heart failure as a result of that. What's the next thing you can see? Well, decreased flow of oxygenated blood to the digestive system. So you have poor digestion. Oftentimes, people with heart failure, the main symptom they have is loss of appetite. or they may have indigestion. They have poor nutrient absorption. They don't absorb their medications very well. So the medication can become less effective if you have heart flow with decreased flow because the GI system is not working effectively. Decreased flow to the liver. We've seen patients have decreased metabolism of the liver and increased toxin buildup in the blood. And eventually, you can get so much congestion in the liver, as I'll show you in the next slide, that you can get cirrhosis and even liver failure. Decreased blood flow to the brain. That leads to brain fog, memory loss, depression, mood changes. So just keep in mind, someone with heart failure, they may not have symptoms of shortness of breath right away. The earliest symptom may be indigestion or brain fog or some of these other types of symptoms that you don't typically think of related to the heart. And then, of course, other organs, thyroid glands, skin, adrenal glands could also be affected and may not manifest so overtly, but we can see evidence in some patients who have heart failure, who have these the signs of adrenal gland or maybe thyroid dysfunction or the like. How about increased congestion? What effects can that have on the body? To some extent, similar to decreased flow. But because you have increased pressure in the lungs and the right heart, that's what we call increased pressure in the venous return system. So blood is trying to get back to the heart, backs up. And so this can affect congestion and swelling in the liver. And as I said before, the liver is getting less oxygen. Now it's being congested. And we've seen patients with liver cirrhosis secondary to heart failure. And so they have decreased protein production, fluid overload, and cirrhosis. Congestion and swelling of the intestines. You can have poor food absorption, poor medication absorption, as you said before, and lots of nausea and vomiting, especially have lots of edema and swelling in the intestines. And of course, increased pressure in the lymphatic system. So have increased waste building up in the tissues, lots of swelling and skin infections. And lastly, increased swelling in the legs. You have lymphatic overflow and infection that goes along with lymphatic congestion. And one other comment about the congestion and swelling in the liver, many people can have signs of hepatic encephalopathy. That's a neurological condition associated with liver failure. And sometimes patients with heart failure can present with mood disorders. They can have cognitive decline. They can have a presentation of someone with dementia because their cognition is low because the liver function is impaired. And you can get more information about this in my talk I did regarding fatty liver, and the link is in the description on this talk. So let's talk about the effects of detox. So how do we fix these things, and how are these things fixed with nutrition? Seems like there are a lot of complex problems. How can something as simple as nutrition have a positive effect on these serious problems that are related to heart failure? Well, the biochemical effects of detox diet are fairly straightforward. There are two things you do with a detox diet. One, you remove animal protein and other toxic foods. And the second thing you do is you add nutritionally dense plant foods in a minimally processed fashion. So let's talk about what happens when you remove animal protein and other toxic foods. So when you remove animal protein, you have a decrease in the amount of inflammatory triggers and a decreased amount of waste buildup. And we noticed from the beginning, inflammation is a key underlying triggering factor for heart failure as well as other chronic illnesses. Well, when you decrease inflammation, you decrease mitochondrial disruption. Remember, we said the mitochondria are like the batteries of the cells. So if your heart cell batteries are running low, then they may need a recharge. By simply removing toxic foods from your diet, it's almost like recharging your heart muscle cell batteries. Decreased fibrosis or scarring in the heart muscle itself, that decreases stiffness. So that's important. And of course, decreased oxidation. Muscle cells start to heal when there's less toxic chemicals floating around causing destruction. So the next component is the consumption of raw plant foods. Well, first and foremost, the biochemical effects. Again, by reducing the toxic foods, you reduce inflammation. But when you add naturally plant foods, you reduce inflammation further. So there's a synergistic effect by the removal of toxins as well as with the addition of raw plant foods. Now, the other important thing is you increase hydration within the blood vessels and within the cells. I said you can have lots of swelling due to lymphatic congestion and venous congestion, but this fluid retention is in what we call the interstitial space. It's outside the blood vessels, outside the cells. Inside the blood vessel, inside the cells, oftentimes the patient dehydrates. So lots of patients with heart failure, they'll come in, they're total body fluid overload, but they're what we call intravascularly volume depleted. There's a depleted amount of blood flow and volume inside the arteries and veins, which is where the blood volume needs to be. And therefore, there's inadequate circulation. There's an inadequate amount of hydration in the cells where the hydration needs to be. So you have abnormal cell function. So natural plant foods help intracellular hydration, and they also help with decreasing toxic waste. The physiological effects, the natural plant foods, especially green foods, can improve nitric oxide production, reduces vascular resistance, it increases circulation, and it helps reduce the backflow congestion. So I put patients on a raw detox diet, and they have heart failure. We're able to take them off the diuretics because the heart starts circulating fluid better. And so they're able to reduce diuretics for this reason. So I get lots of comments, or at least a fair number of comments, that people ask, well, where's your references for these statements you make? So these next few slides, I'm going to show you fairly quickly some studies that we've done in our center, also a review article by a friend and colleague of mine, Dr. Najjar, that talks about the toxic effects of animal proteins, and we talk about the beneficial plants of the plant diet. I'm not going to go into this in detail. It's beyond the scope of this talk, but I meant to show these slides so you can freeze the video and look up these references yourself. We've done studies in our center where we show you can reduce inflammation and reduce reactive oxygen species with a plant-based diet. We've done it in the clinical setting. I'll talk a little bit about this clinical case series where we had a number of patients with heart failure come through, and we'll show you the hemodynamic findings. So this is a series of patients with congestive heart failure, and we did cardiac MRIs before and after. So we had accurate measurements of the ejection fraction, other hemodynamic parameters, and they only underwent a plant-based diet, a minimally processed plant-based diet. And the ejection fraction on average started at 22%, went up to 44%. The heart LV mass, or enlargement or thickening, decreased significantly. There was an increase in stroke volume. That's the amount of volume that's ejected with each heartbeat or each circulation. And then the baseline cardiac output improved or trended toward improvement. So we saw significant improvement in cardiac function. This is a coronary angiogram of one of those patients. She was a lady who was 46 years old, presented to us with chest discomfort, and she had a very critical narrowing. This is called a widowmaker. It's about a 95% narrowing. After just 5.5 months of plant-based diet, it went away. The other vessels improved as well. So it has a global effect, improving heart function, as also opening up coronary arteries. Now, I'm going to say a little bit about regenerative therapies. In addition to nutrition, we use a number of key regenerative therapies. I'm not going to spend a lot of time on this. I'm going to do a separate video on regenerative therapies, but I think it's important to just share this with you briefly in this talk. What are regenerative therapies? These are the advanced therapies that we use when a patient is very, very sick, and we want something to help accelerate the healing along with the nutrition. I'm going to go through this quickly. Infrared sauna therapy is one. Intravenous ozone therapy. High-dose vitamin C we've used in patients. Methylene blue. External cardio assist device and chelation therapy. This is someone getting external cardio assist, and these are some various infusion therapies. There are two things I'm going to give a little more information. Infrared sauna, and I'm sharing this with you because many of you may live near a gym with a sauna. Now make sure you're getting clearance from your physician to do this. But sauna therapy, and this is all scientifically shown benefits. Nitric oxide production and endothelial function is improved, circulation improved, blood pressure lowered. We have lots of patients with high blood pressure that have improved blood pressure. Peripheral blood flow, we have data showing that. Reduction of inflammation as well. Ozone infusion is another therapy that we use for cardiovascular disease. There's an increase in oxygenation of ischemic sites. So ozone is O3. We infuse medical grade oxygen through an ozonator. It makes a certain mixture of O3 and we use a high dose ozone called extracorporeal blood oxygenation ozonation called EBOO. I'm not going to spend a lot of time on this. I'm going to give you some bullet points on how it works. I promise you I'll do a talk on these regenerative therapies because it's really important for you to be aware of. Because patients who are very sick who've come to our center, these are people on transplant lists with the nutrition, and some of these regenerative therapies have great outcomes and get great improvement. But some of the things we can ozonate a large amount of blood, up to 2 to 3.5 liters in about 60 minutes. It's basically just 2 IVs. It's a simple procedure. It's well tolerated. It boosts oxygen levels, stimulates circulation, enhances cellular metabolism, supports the body's overall natural healing mechanism. So these are some other therapies. Again, we'll talk about this very soon. So let's wrap it up with some things you can do. So what are some 4 basic detox regimen? So get your pen and paper out, or cell phones, and get ready to take photos of these next slides. The basic raw detox consists of the meals that you would get. You would start with the morning hydration with raw juices, smoothies, coconut water. You want to hydrate with plant-derived water. Midday meals would be fresh whole fruits, raw seeds, nuts, or salads. And then evening meals consist of salads and fresh fruit. This is our baseline level detox. If you want to make the detox more aggressive, then you would do like a green smoothie detox. The green smoothie detox would have key ingredients. I always like to make our smoothies with a plant-derived water. So maybe it's a coconut water. Don't get it out of the bottle. You can maybe juice a cucumber and use the water from the cucumber juice as your liquid base. And then you can mix things like spinach, kale, other greens, a blue-green algae. We use E3 Live, barley grass, freeze-dried. These are some key ingredients we like to use. These are super ingredients. And then you can use frozen fruit of your choice, whether it's maybe a pre-soaked date or frozen pineapple, or mango, etc. And so this is the second level detox. The most aggressive level would be a juice feast. And then the key ingredients, sorry about the typo there, should be say key juice ingredients. You can start off with a coconut water during a juice feast. You can have raw juices with green vegetables, vegetables, or fruit. And you have any mixture of these. Alkaline water can also be consumed during the juice detox. We always like to add a blue-green algae to the juices to add nutritional fortification. And of course, a barley grass, a freeze-dried, you can shake it up into the juice. Now, how do you put all this together? Wheatgrass shots is also something that I recommend. So you put all this together in the standard intervention program. This is what we do for our patients, and you can kind of mix it up however you like. Depending on how sick the patient is, depending on what dictate how we start. The first 7 to 15 days, we may start them off on the raw juice feast. So 7 to 15 days, nothing but juice, okay? After that time period, we may advance them to smoothies, something a little bit more hearty, the next 7 to 15 days. So let's say, for instance, they do 7 days on juice, 7 days on smoothies. So that's roughly 2 weeks. On day 15, we advance them to salads. We'll add salads today. If they did 15 and 15, then on day 30, we'll add salads. So we're rapidly progressing up, still keeping everything raw, but it's letting the body detox more aggressively, but just sort of backing off, making it less stringent early on. You can actually flip it around. You can start off with salads with a less aggressive detox and make it more aggressive over time. So you can do it either way, and we've done it both ways. After about 30 to 60 days, you want to continue all raw for that time period. And then you can start to add some steamed veggies and veggie soups on day 61. However, everybody's different, and some people may need to have a raw detox longer. So if on day 61 or 62, they start to have some recurrence of symptoms, you can go back to the raw phase and let them go longer because they may not be fully healed. So I hope you got a lot of this video. I know it's a little bit longer than my usual videos, but I wanted to give you a lot of fundamental information. Go back to this video, pause it, stop it, take photographs of some of the slides. But if you get this basic information, I think you have a great foundation of what heart failure is and how it works. I hope it will give you information that makes heart failure less intimidating. And I hope you've been empowered through this information to take action to start improving your health. Of course, heart failure is nothing to play with. If you're diagnosed with it, keep your doctor's appointment, see a physician, take the medicine that's prescribed, but you can do things on your own to improve your overall health. Because it's my goal through not only this video, but other videos and our show in general, is to help make you your own expert. Until next time, take care. And of course, if you're new to the channel, subscribe, like, and share. And if you're an old timer, just like and share. But please share this with everybody that you know, because I think this is going to be very beneficial to the public. Until next time, take care.